Welcome to the Pursuit of Truth. It is the 3rd of March. April. Why do I keep saying March? April 2020. And I'm going to pick up from the pharmacy an inhaler because now the Livy GP thinks that I have seasonal asthma. I don't know if that's the case or not. Another human guinea pig test I'm going to do now. I've got to take 2 puffs every 4 hours. Because I've been getting wheezy last week or so, just only a little bit. So I don't know, I've never had hay fever or anything like that before. So I don't know if this is in the back of that lung thing or this is just another guess because they've tried everything else. Still waiting my thoracic department. Yeah. So, here I am. I've got some clips I'm going to put at the end from Sky News. Interesting about the tests that they're doing, how, because there's a lot of people that are saying that maybe these tests won't be accurate because it'll search for coronavirus rather than specifically the strain of COVID-19. Interesting how sometimes they use the word coronavirus when they talk about like the celebrities who've got this thing rather than using COVID-19. So the problem is that will it test for that particular strain? And so there's even Matt Hancock, the health secretary of the NHS, was talking about that. Talking about how a pharmaceutical company gave him a drug that only worked 3 times, that failed 3 times out of 4. And then you see like how these pharmaceutical companies work. That's a bird. So I'm sure I've got to go now. I think it's around this bit. I don't know where I'm going, to be honest. I'm not on the highway, so yeah. Take care, please. God bless and peace. Some nice scenery that I'm walking to. The windmill is over the back. Let's see how my train's going. Yeah, I'll just add to that. The pharmaceutical company, they're meant to be trusted. They give you medicine and drugs that we take. And they were given it failed 3 times out of 4. Imagine if they'd used that. Maybe some countries are using that, and that's giving false results one way or the other. I mean, how is it possible that they didn't test it and find out? But they still released it to try and make money out of this.
But as the head of Roche and the President of the United States have commented, this is a global challenge. I'm sure that we'll get there. Next, there's the challenge of prioritisation. Look, I understand why NHS staff want tests so they can get back to the front line. Of course I do. But I took the decision that the first priority has to be the patients for whom the result of a test could be the difference in treatment that is the difference between life and death. I believe anybody in my shoes would have taken the same decision. I'm proud that every single patient who's needed a test for life-saving treatment has had access to a test.
Not sure what treatment he's talking about.
Of course, NHS staff need access to testing too. And I'm delighted that at the weekend we could roll out this access for the first time. And there's a challenge too of making sure that the public can have confidence in tests. Several of the tests that we're currently checking have failed. In one case, a test that I'm being urged to buy missed 3 out of 4 positive cases of coronavirus. That means in 3/4 of cases, that test would have given the false comfort of sending someone with coronavirus back on the wards. Approving tests that don't work is dangerous, and I will not do it. Now, these are some of the challenges that we've faced, but I want to set out my plan to boost testing.
Better than some, at least in terms of the number of tests they managed to get out. Their test total did increase by 149 in the last 24 hours, however. Well, experts say scientific modelling suggests the peak of the first wave of the COVID-19 pandemic in the UK will come between the 6th and the 20th of April. There is likely to be a second wave when the current restrictions are eventually relaxed. The size of that wave will depend on how and when restrictions are relaxed or indeed reintroduced. We're joined by Professor Carol Sikora, Chief Medical Officer at Rutherford Health, Professor of Medicine at the University of Buckingham, world-renowned oncologist as well. Carol Sikora, welcome to you. Do you have a timeline that we can consider as a likely one?
He's an oncologist.
I'm just an oncologist. I'm not really an
Cancer.
epidemiologist, but it strikes me, if you look at what's happened in China and Korea, the main wave goes through in 4 weeks. So we're just entering the main wave now. So we would imagine the main wave of high incidence, high death rate will be over by the end of the month. The real question is, how do you relax social distancing at that point? And there's no science behind that. It's just a judgment call, and it's a difficult judgment call. Some countries will relax it early, and Sweden's not even gone that way for some reason. Other countries will relax it late. Testing for those that have been infected, and therefore to know what percentage of the population in the UK are actually infected with the virus, is sort of critical now, because that would guide the relaxation of social distancing and help business to get started again.
Yeah, it's been described by the Prime Minister as a game changer, but it would need to be well handled because, you know, human nature being what it is, you'd require presumably some system of certification. People would need to be able to demonstrate that they have had it.
Absolutely. And it would have to be validated. In other words, you couldn't just sell the kits in the chemist shop and ask someone, are you positive or negative? Even if they take a photo of their own, how do you know their own blood was put, the droplet of blood from the fingerprint was theirs? So you'd have to do it in a professional way, either in the workplace or in pharmacy or in testing stations. It would tell you that someone had been exposed to the virus and has mounted an immune response to it and therefore is likely to be immune. Now, on the cruise ships, interestingly, these people are well studied with lots of tests now. And it looks as though about half the people that were definitely infected never had any symptoms at all. And these were predominantly older people, because that's the demographic of cruise ships, people over 70. That's telling us something, that somehow, if we could test the population and find out who is actually gone through the process of coronavirus, then that you can release them into the population. And if it's 40% or 50%, and the epidemiologists argue about that already, then it may be possible to liberate social distancing, first week, second week in May, we'd all be delighted if that was the case. At the same time, if that's not the case, and say only 10% of the population has been infected, we may have to wait till September. And that would create huge social problems for this country and other countries.
Wouldn't it? I mean, a lot of mud is being slung at the government on testing at the moment. How much, if any, sympathy do you have for them, given that it's an unusual situation, isn't it? I mean, you've been on a lot of television screens before. The argument's sometimes been about rationing resources, with, campaigners saying, we want this for this project, the government saying, yes, we'd like to help, but, we have to consider other spending priorities. Here, that doesn't arise. That's not the situation we're in, is it? The government agrees with its critics. It wants to roll out testing as much as it possibly can. It just doesn't have the wherewithal.
Yeah, I rarely feel sorry for politicians, but this is one circumstance where you have to. They're making life and death decisions in an area they're not familiar with. If we go to the antibody testing, we've got the kits here. I'd love to test all the staff tomorrow. They're arriving tomorrow. But how do I know that what we're testing for is the current coronavirus? If it's just picking up old episodes of corona that everybody's been exposed to, not of this strain, but other strains in the past, it's no use to me. I'll get people that I think are okay, that are not okay. I think they're safe to go and see patients, but they're not okay. So these are the questions that politicians are struggling with. It will get sorted out. The British science base is at their command to sort this problem out, to come up with a kit just like the Germans have done, just like the Chinese have done, and validate it. And once we've got that, life will become a lot easier and more scientific. Meanwhile, it's going to get rougher and rougher over the next 10 days, I suspect.
Well, and rougher in different ways. I mean, can we just finally and briefly talk about your previous area of expertise, or still area of expertise, oncology? And presumably there will be, I don't know what sort of quantum we're talking about, hundreds, maybe thousands of people who are right now developing tumours, cancerous symptoms that will go unrecognised, untreated, and they will die sooner than they might have done.
500 people a day get the diagnosis of cancer in Britain. So that means there's a lot of people out there. So So several thousand are going to be affected. They're already affected emotionally. I mean, people are just getting letters or emails through the, into the pinging to their emails chain saying, don't come to the clinic. Your chemotherapy has been cancelled. Your radiotherapy has been postponed. Now, in some cases, it may be better to postpone it. And I've advised patients just hang in for 4 weeks before you start, just in case you get COVID during that time. Better not to have your immune system suppressed. In other cases, it's a rationing decision. We can't treat everybody. We're trying to limit the number of patients coming to the hospital. The doctors, the registrars, young doctors, and the nurses may be taken off to the wards for respiratory care. So it's important that we try and minimize the damage and sort out who is really at high priority to go through. So a young boy with Hodgkin's disease, for example, completely curable, 98% chance of cure with modern treatment. We shouldn't be stopping his treatment. We should do everything to make that happen.
Carol Scott, I'm afraid we've got to leave it there. We'd like to get you on again, I'm sure, but for now, thanks very much indeed. More news coming up here.
Probably fair to say the chances of them having picked up a coronavirus infection is probably quite low, so I wouldn't worry about it, unless, of course, you've been given advice otherwise by your employer, which is where I take it to come from.
Yeah, maybe the journey home would be more risky than being on the oil platform.
Possibly.
Now, Dr. Rosemary Leonard, Alan says everyone is pushing for National Health Service staff to get tested, see if they've got the virus. What about private healthcare workers such as me?
So the testing, frankly, from my point of view and all my GP friends, it's chaotic, absolutely chaotic. It's the one thing which I think has gone very, very badly wrong in all of this, and I don't say that lightly. My practice pharmacist got flu-like symptoms on Monday. She does not know whether she's got COVID or not. We have no idea how to access this supposed testing site at Chessington because no one's let us know. And as far as I heard, very few NHS workers are managing to get tested. I honestly think private healthcare, I think that everyone's in the same boat here. The testing system just isn't fit for purpose in this country compared to other countries like Switzerland or Germany. I really don't know quite what's gone wrong. It may be to do with the fact that we've been trying to do it centrally through Public Health England rather than in other countries where they're doing it on a more local basis. I think our best hope is going to be when we have antibody testing, which is to check whether you're actually already immune to the virus, whether you've had it. One of the problems with antigen testing, which is the check to see have you got the virus here and now, are you infectious now, is it actually isn't necessarily terribly accurate. You've got to get the swab taken right at the back of the mouth, and you've really got to rub quite hard. And we know there's quite a lot of false negatives. That is, people who've actually got the virus, they test negative, they have another swab done, and then it comes up positive. So I think the testing, it's awful, and I'm really sad about that for the sake of this country, but I think our best bet's going to be the antibody test when you can see, have you had it, are you immune, and therefore in terms of health workers, it means you can get back to work and not worry about being infected.
But if you are a health worker in whatever sector, NHS or private, and you get the opportunity to have an antigen test, should you bother to have it?
Yeah, if you can get it done, but it's not clear how you do it. You've got to get from what, I mean, nobody has written to any of my local practices. We were all discussing this in my surgery. We're in South London, so presumably if we wanted a test, we'd go down to Chessington, which apparently is empty. But apparently you have to get on some form of list in order to get in the gate. We don't know how to get on that list. Nobody has told us. I mean, it's just a shambles.
Well, I'm sorry to hear that. You're watching Sky News. Coming up, our panel will be answering.
Well, when they don't like something, they cut off, huh?
Your questions about coronavirus.